Welcome. Right now, it's June 2023. Almost 2 years ago, Japan experienced its largest wave of COVID-19 infections to that point. Those infections peaked in August 2021, and then they dropped sharply by October. Of course, infection waves happened before, and there were much larger waves still to come. But this one, in August 2021, led to a specific attempt at explanation. And the explanation was that the Japanese were saved by the use of ivermectin. One of my first misinformation videos on this channel was on this very topic. But in this video, I want to revisit the topic and see what we can learn with the benefit of 2023 hindsight. Okay, welcome. If you're new here, my name is Greg Tucker Kellogg, or Prof. Greg. I'm a professor at the National University of Singapore, and my videos on this channel cover a range of topics related to biotechnology, bioinformatics, and more recently, issues in scientific misinformation. I want to be clear that I make these videos out of my own interest in education and my frustration with the harmful effects of scientific misinformation. I don't have any conflicts of interest in this. I'm not sponsored for any content, and I make these videos in my spare time and using my own resources. Okay, so here's an outline of the rest of this video. First, let's refresh our memories of the then big peak in COVID-19 infections in Japan in July, August 2021. After that, I want to discuss the theories that were made to explain that peak in cases and sharp decline. There are two main theories. One is a dramatic effect from ivermectin use in Japan. And the second is basically events surrounding the 2020 Tokyo Olympic Games, which were postponed because of COVID to 2021. Next, I'll discuss what we know now in 2023. We have more than the benefit of hindsight in 2023. We also have the benefit of research. Here's the spoiler alert. We can now say with pretty much certainty, based on data, that ivermectin use didn't have any meaningful impact on COVID in Japan in 2021. We can also say with pretty high confidence that the Olympic and Paralympic Games had a variety of effects, direct and indirect effect. And those effects explain much of, if not all, of the July-August peak in cases and the subsequent decline. Finally, I want to close with some thoughts on critical reasoning. This story, the ivermectin saved Japan from COVID story, it was always a bad argument, but it's worth understanding why. So let's get started. We'll start with part one, which is the peak itself. Let's understand this peak, where it came from, and how it was seen at the time. Okay, so this was the peak. It was a big case peak in 2021, the biggest they'd seen to the time. And it was described at the time as Japan's fifth wave of COVID cases, but it was much bigger than the previous waves. You can see it here. So here's wave 1, 2, 3, 4, and 5. This is the peak we're talking about. The first two waves are in fact so small that they barely show up on the chart. If we focus on 2021, not just 2020, you can see how much larger it was. You can also see that it declined very rapidly through September, and by mid-October, the cases were remarkably low. This is the observation that people wanted to explain. While we're reminding ourselves of what happened in 2021 in Japan, I also want to make note of another incident. Contamination was found in 3 batches of Moderna's COVID vaccine in Japan. And those 3 batches were recalled on September 1st, 2021, only a few days after the peak of new cases. This is actually only 3 batches, and it was a total of 1.63 million doses. That was a relatively small portion of the total doses that Japan was rolling out at the time, but it was nonetheless a newsworthy incident. Okay, so that's the background. Now, let's turn to the explanations people offered for what was observed. Maybe the first thing we can ask, with hindsight, is do we even need to explain this? At the time, of course, this peak was quite large. This was the peak here, what seemed like a massive wave in late summer 2021. That was the Delta variant. You remember the Delta variant? It was bad, and it caused a lot of hospitalizations and a lot of deaths. But nobody had seen what Omicron was going to do. Looking at this chart, is this really something that we need to explain? But, here we are. So let's look at what was offered. The first explanation that we want to look at here is this ivermectin miracle, that Japan was rescued by the use of ivermectin. And that had to be rapid. And so this explanation has, as I see it, three parts. First, there was a press conference. There was a press conference on August 13th, 2021, that was given by the chairman of the Tokyo Medical Association, Dr. Ozaki, who argued that the situation was dire and that people should be allowed to give consent for use of ivermectin. That was the first part. Second, there's this observation that new cases peaked around August 26th, 27th, and then they declined very rapidly afterwards, and by the end of October, it was basically almost negligible levels. Now, I said this was three parts, and the third part is to simply connect the first 2 points and make the claim that one looks like it caused the other. Since we have the benefit of hindsight, let's ask another question. How did this explanation actually occur? And for this, the article, as far as I can tell, so I've tried to look using the resources that I have to find articles in English. And so the first English language article that I've seen, it was covered locally in the Japanese public media. The first English language article occurs in a website called gnews.org. So gnews.org is a very specific website. It was set up as an anti-Chinese government website, and it was set up by the Chinese exile Guo Wengui, and along with Steve Bannon, the right-wing political strategist. A lot of gnews.org's articles, and it has an internet TV channel as well, a lot of them are in Chinese, but in this article, they argued that the speech by Dr. Ozaki, the chairman of the Tokyo Medical Association, gave a green light for ivermectin in Japan. Now, that G-News story was picked up immediately, the same day or the day after, on a fringe website that was run by a climate change denialist named Ron Klutz. And pretty soon, it wound up being discussed on 4chan, the conspiracist anonymous message board, 4chan. And then shortly thereafter, there was a tweet with a video of Dr. Ozaki's speech, or an excerpt from Dr. Ozaki's speech went somewhat viral on Twitter. And over the next month or so, the discussion of this speech stayed alive on these kind of fringe elements for that period. And then at the end of October, there was another story. This was a story on a radio show and a website of this far-right white supremacist and a convicted felon. He was convicted for threatening various, I think, judges, Hal Turner. And as far as I can tell, Hal Turner was the first to claim that ivermectin was the cause of the decline in COVID cases. He may have picked it up. I would expect that he followed things like 4chan and other types of sites. But as far as I can tell, he was the first to make that claim, that COVID was the cause of the decline in COVID cases in Japan. He also added a new lie. And that lie was that Japan had stopped vaccinations. Now, this was based on that Moderna recall of a few batches of vaccine. But it was a lie. In fact, the opposite is true. Japan had actually accelerated vaccinations during this time, not stopped them. But still, even with Hal Turner's bit, it was still in the kind of far-right fringes of these corners of the internet. But a few weeks later, the explanation got a much, much bigger boost. And that was when Pierre Corey tweeted on the 22nd of November And he added a little bit more falsehood. He added this recommendation from, he said that they recommend that all doctors in Japan use ivermectin to treat COVID. That's not actually true. In Dr. Ozaki's speech, he recommended that patients be allowed to give consent to use COVID. So Pierre Corey tweeted this on the 22nd, and as day follows night, Dr. John Campbell put out a video originally entitled Miracle in Japan. He changed it a few days ago to Ivermectin in Japan, where he made claims of this. He was careful not to say that it was causal, but he strongly implied that it was causal. So that's over basically a couple of months, 2 or 3 months, and the story gained a bunch of details that were false as it moved into the more mainstream areas like Twitter and Dr. Campbell's YouTube channel. And even though most of those falsehoods were debunked pretty quickly, the basic story is still widely believed. So, here are some of the falsehoods. So via 4chan and Hal Turner, Japan had stopped the vaccine rollout. Totally not true. In fact, the opposite is true. From Pierre Corey, this falsehood that Dr. Ozaki recommended that all doctors in Japan use ivermectin for COVID. Again, that's not what he said. He's talked about possibility of using it and the consent, patients giving consent for its use. Via John Campbell, ivermectin allowed as a treatment in Japan on the 13th of August. Totally not true. The Tokyo Medical Association is a private group, has no regulatory power. It's only local to Tokyo. This is, just totally not true. Nonetheless, all these claims were made and they kind of embellished the whole story of this. So this misinformation and this belief still persists today, despite the debunking of these falsehoods, still believed by ivermectin advocates. And I think that's in part because the people who originally promoted this story have simply never revisited it as the evidence piled up that it couldn't possibly be true. Okay, so that's the ivermectin miracle in Japan story. The other explanation is it probably had something to do with the Olympic Games. Okay, and this also has 3 parts. First, the delayed games from 2020, delayed to 2021, they overlapped with the peak. Straight up, that's what happened. Second, holding the games required a lot of international and domestic travel. And all of that travel basically worked against all the overall restrictions that were in place at the time, despite the efforts to make the Olympics a kind of a special place. And finally, the renewed social distancing combined with the vaccine update or vaccine rollout during this period accounted for the rapid decline. Now, to be fair, I also want to take a look at where this came from. We looked at where the ivermectin story came from. Let's look at where this came from. So this came from, in some sense, it originally appeared before the Games. So it predates the Olympic Games. And if you recall, or if you look on the news at the time, whether to hold the Games at all was an open question, and it was a major topic of international debate. The Games had already been postponed from 2020. There were protests in Japan against holding the Games. And some countries, like Canada and Australia, made a decision not to send athletes to the Olympic Games in Tokyo because of the perceived risks. So this was a big deal at the time, and there was a lot of worry that there would be a peak at that period. Second, inbound international traffic did shoot up. It shot up about 5-fold because international traffic was very curtailed just prior to the Games. And that traffic, that increase in traffic, was, like the peak in cases itself, very short-lived. So that served as a convenient explanation for the rise in cases. Here I have a timeline of the new cases, and I've overlaid that with both the Olympic Games and the Paralympic Games. And here is the inbound visitors to Japan per month from the Japanese Tourism Board. And the third part of this was that Japan was in the midst of an intensive and rapid vaccination program, and that might have helped steepen the decline. Okay, that's the end of part 2. Now let's look at the third part of this video, which is 2023 hindsight. What we've looked at is how things stood around the time of the Olympic Games. Now, 2 years later, what can we say in hindsight? I think this is important to look at because the passing of time here is an opportunity not just for reflection, but it's also an opportunity for research to happen and research to get evaluated and research to get published, and we can look into the assumptions of the day. So let's look at those in turn. So the first is the ivermectin explanation in hindsight. The ivermectin save Japan explanation has this really essential requirement. The Japanese people needed to get ivermectin and they needed to use it. This was, of course, the entire point of Dr. Ozaki's speech. So a question is, did they? When I did my video in late 2021 on this topic, I said there was no evidence, but now do we have evidence? Well, a group of Japanese researchers examined exactly this question, and they published their analysis in the Journal of General Internal Medicine late last year, late in 2022. Watari et al., these are the authors, they used a large database for a retrospective observational study. So this is a hospital-based database, a hospital network. It's an administrative database to look at confirmed COVID-19 cases and ivermectin prescriptions. So this database is called the Medical Data Vision Database in Japan. It has over 350 healthcare institutions and 32 million patients. Another way to look at it is that it covers 20% of hospitals in Japan, and it covers about 8% of all patients in Japan. It is absolutely massive, and it's probably a good representation of the overall patient population in Japan. So what did they find? This chart shows, is overlaid, kind of a double wide chart. I don't care for that kind of chart, but this is from the paper. It shows ivermectin prescriptions in gray bars, and the scale of those prescriptions is on the right. These are these gray bars for prescriptions per month, and COVID deaths on a dotted line. So it's not showing cases here, but deaths on a dotted line. You can see that a scale on the left. And you can see, among other things, that the uses in, say, May here peaked around the same time as the deaths. So did the Japanese turn to ivermectin for COVID? There were 140,442 confirmed COVID-19 cases in the database during this time period from January to November. Of those, 175 were prescribed ivermectin. That's about 0.12% of COVID-19 patients. This was basically minuscule, very, very small amount of uptake overall. It peaked in May 2021 when deaths peaked. And if you look at it, maybe there was a little bit of peak here, in August, which was when Dr. Ozaki gave his speech at the press conference. But that may also have been just because cases were rising. So if you look at it this way, what I've done here is taken the data from the paper and plotted it using nationwide case data in Japan and then scaled it to the number of patients in the Watari et al. Study. And what you can see is that as a percentage of new cases, August was actually lower. So even though the number of ivermectin prescriptions went up, as a percentage of COVID-19 cases, it's actually quite low. So interestingly, this paper, while it's a bit of a niche paper, it generated some correspondence. So there was a pro-ivermectin letter published in the journal after the study was published. And Watari et al. Had a chance to reply to that correspondence, as happens. And in their reply, one can kind of sense the author's frustration at having to turn attention away from helping patients in order to address misinformation on social media. So here they say social media has fueled the spread of scientifically unproven junk information, even among the medical community. And I think in that case, they're referring to the letter writers in this. Such information is amplified across society, politicizes scientific debates, and downplays concerted efforts which may eventually cause harm to patients. So this is basically turning their attention away from that. Okay, so that's what we can say today about the ivermectin explanation in hindsight. How about the Olympic explanation in hindsight? What can we say about that? Well, here, there have been literally hundreds of research papers on this topic. They deal with a really wide range of detailed questions, like how much did the Tokyo 2020 Olympics contribute to the spread of COVID-19? Not just in Japan, but maybe did the Delta variant, there was a particular subvariant of Delta that occurred in Tokyo, and did the Olympics help that spread overseas? Things like that. How well did the containment measures work at the Olympics? Did the preventative measures have any effects, negative effects on athletes' mental health or athletic performance? And what can we learn about preparing for large events, both sporting events and other types of events like religious events during future pandemics? Now, the literature is quite large in this, so I'm not going to go through all of it, but I do want to give just a couple of examples to highlight. One is this paper by Yashio et al., which was one of the first papers in a travel medicine journal published by Elsevier. And they looked at infections among athletes and associated Olympic staff. And they found that the bubble was probably successful in keeping infection rates low among athletes. They also found evidence that suggests that the games personnel who weren't subject to the same restrictions with respect to the bubble as athletes may have kind of pierced the bubble and allowed infections or to cross between the local population and the athletes. Interesting, some other research papers noted that local television media, so the Japanese national media, which had been focused on the pandemic, so they'd been focused on the health issues, they had a profit motive to switch coverage to the games. And this may have contributed to relaxed practices and behavior in Tokyo. And finally, the authors here note that the whole system set up for the Olympic and Paralympic Games was based on a model of transmission of COVID by droplets, not airborne transmission. So it may have had some inherent weaknesses relative to what we know now. Another study is by Ezaka and Fuji, and they conducted an economic analysis. There are actually several related papers from different groups in the economics literature. And what they're trying to do here is do a causal analysis. And I won't go into the details of how these types of causal analyses work, but I learned a lot from reading this paper and the other papers. They are looking at a causal analysis of cases from the games. And the results of these papers suggest that holding the games was a major cause of increase in cases, and it's basically a robust indicator that the games caused a major increase in cases with these various different types of estimated controls. They don't have a direct control because it's not a real experiment. There are other papers on the rapid rollout of vaccination. It seems plausible that holding the Olympics, while it led to an increase in cases, may have also helped accelerate the rollout of the vaccine, and that may have contributed to the steep decline. So this is what we know in hindsight about both the ivermectin for COVID in Japan story and the Olympics story. At this point, I think we've established that the ivermectin miracle in Japan is a fiction, and that the 2021 peak in cases was driven by a combination of factors related to the Tokyo Olympics, the Paralympics, and Japan's vaccination program. But I want to take the rest of the time in this video to make another point or another argument. which is that the ivermectin Save Japan story was never plausible. It was always misinformation, and that one can develop the skills to recognize it as such if this maybe comes as a surprise. So let's do a thought experiment to test the hypothesis of ivermectin saving Japan. What would need to happen for this to be true? Well, for this to be true, the Japanese public would need to do a bunch of things. They would need to hear about the speech by the head of the Tokyo Medical Association. They would need to go to their doctors and get ivermectin prescriptions for COVID-19. They would need to use ivermectin. They would need to have ivermectin work. And all of this would have to happen to an extent sufficient to turn the peak around, this fifth wave, at then the largest peak, to turn that peak around within 2 weeks from the time of the speech. That is a big ask. That is a big expectation. Was there any evidence at the time that any of these things actually occurred at a significant level? Well, no, none. Was there any evidence offered? No, none. What do we know in 2023? So this is this same slide. What do we know? Did the Japanese public hear about the speech from the head of the Tokyo Medical Association? Maybe. They didn't do much about it. Did they get ivermectin prescriptions from their doctors for COVID-19? No. It's pretty clear that the Watari et al. Study says that didn't happen. Did they use ivermectin? Also no. And did they have ivermectin? Did ivermectin work for COVID-19? Well, in this case, we know a lot more about other clinical trials, about many clinical trials. And the consensus of those clinical trials is that ivermectin doesn't actually work for COVID-19. It doesn't provide a patient benefit for COVID-19. So we know all of this in 2023, but we didn't have any evidence for any of it, even in 2021. Gamblers talk about the tell when they know someone is bluffing. Maybe it's a move of the hand, a scratch of the head, some tick, something that gives a player away. What's the tell for the ivermectin in Japan story? Well, part of it we just saw. There's a huge leap of things that need to happen, going from that speech, from the head of the Regional Medical Association, to a massive uptake of ivermectin and reversal of cases. It reminds me of this famous cartoon from Sidney Harris in 1977. Set of equations, a miracle occurs. Now, in this case, a miracle has to occur in this equation and kind of also in response to Dr. Ozaki's speech. And if you remember, the original title of John Campbell's video was Miracle in Japan. So may have been close to it. But there's more to it than that. What are the misinformation tells? How can misinformation tell on itself and let us know that it's happening? I'm going to walk through a few characteristics of this. One is oversimplification. Science is hard. Medical science is complicated. But in misinformation, there's often a potentially satisfying but oversimplified answer that's offered to a complex problem. And when you see that, I think that's a tell. Oversimplification is a tell. Another is what I'm going to call in this case displacement of evidence. And so what I mean by that is the case for what happened within Japan is basically built on stories that are largely told outside Japan, where the evidence would be most sparse. If you were looking for evidence, the evidence would be most sparse. In fact, those who promoted the ivermectin in Japan story simply looked away instead of looking at Japan. They never pointed to Japanese social media. Maybe you would expect to see social media organizing people to acquire ivermectin. They never really pointed to Japanese news reports of people going to their doctors for ivermectin, or doctors who were moved by Dr. Ozaki's speech. They never asked people in Japan what was going on. The only evidence, and I'm using finger quotes for this, from Japan was Dr. Ozaki's speech itself. Another tell is embellishment. Over time, from September through November, there were a bunch of falsehoods tacked onto the story so that it seemed less ridiculous. 4chan users and the white supremacist Hal Turner took the recall of 3 batches of Moderna vaccine and changed it to Japan stops vaccine rollout. John Campbell framed Dr. Ozaki's speech as ivermectin allowed as treatment. Dr. Campbell also claimed the Japanese could import ivermectin from India, and this may be true, but he did so, and I actually think this may have been unintentional, in a way that suggests that Dr. Ozaki had said that in his speech, which he did not. There are a couple of other key tells, and here I'll play a very short clip from Dr. Campbell's video on ivermectin in Japan. I want to stress, though, that even though I'm using his video as an example, I don't mean to single out Dr. Campbell. These particular tells are very common.
There's the 13th of August, ivermectin allowed as a treatment in Japan. So that was the 13th there, that day there. So 13. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 days. And then the cases started to completely plummet off down to where we are now in Japan. So one of those interesting coincidences. Strangely enough, it's a coincidence that hasn't really been referred to on mainstream Western media. Now let's go on to look at this a bit more detail. So ivermectin allows a treatment on the 13th of August, and we saw that coincidentally just after that the cases plummeted 2 weeks after that. Now, my understanding is this. Now, I'm getting more information from Japan really as we speak. I'm expecting a report from Japan tomorrow, actually, which, of course, I'll send on to you straight away. But doctors can prescribe it without restriction. Ivermectin in Japan without prescription.
Okay, there are 2 things that happen in this short clip that should give a listener pause. The first is the encouragement of distrust. Dr. Campbell says, strangely enough, it's a coincidence that hasn't really been referred to on mainstream Western media. Okay, is that strange? Or is it possible that it's not strange, that it's a non-story, and that you've been taken in by confirmation bias? Encouraging distrust in conventional sources is a very common tactic in misinformation. The second is basically an empty promise. Notice how Dr. Campbell says he's expecting a report from Japan within a day, and that he promises to share it. Now, this never happened. And it's quite possible that if Dr. Campbell did speak to someone knowledgeable in Japan about ivermectin for COVID, their response is, what the hell are you talking about? That's certainly what happened when I spoke with my Japanese collaborators. This was a non-issue in Japan. It was not something that people were talking about. I want to close with one takeaway thought for your consideration. I just described a set of what I call misinformation tells, things you can recognize and use to be more aware, to be more critical of potential misinformation. But if you're familiar with any of the literature on skepticism or pseudoscience, each of the tells I described in the ivermectin for Japan story is also a characteristic, in fact, it's a hallmark of pseudoscience. Every single one. One is easy answers to complex questions. Another is avoiding detailed critique, or even the opportunity for detailed critique. This is when basically sources in Japan weren't really checked. Another is cultivating distrust. Pseudoscience works by cultivating distrust in conventional science. Another is, curious one, not making progress. The ivermectin story in Japan still dates back to that Ozaki speech. There's no follow-up on that. And if you do the follow-up, as Watari et al. Did, you find that nobody took it. Another is peppering truth with falsehood. The people say that the best lies incorporate a grain of truth, and that's clearly the case here. And then finally is a movement of an idea from the fringes. In this case, it was fringes on the far right, or the sort of hyper-populist, distrustful conspiracy sources like 4chan, from the fringes in the direction, if not all the way in, to the mainstream, but using these ideas, these methods. Now, I will say that pseudoscience and scientific misinformation are not the same thing, at least not necessarily. But they use a lot of the same rhetorical tactics, and those rhetorical tactics are designed to get past your critical thinking defenses. So being aware of those rhetorical tactics is a way to defend yourself against misinformation and pseudoscience, both. Okay, that's where I'm going to leave it. If you've enjoyed this video, be sure to give it a thumbs up or a like. Leave a comment if you have any feedback or suggestions for future videos, and I'll see you in the next one.